Step 1 is to check supplies. Here we've got our cold pack and our moist towel. Check freezer for appropriate temperature. 0 to 25 is normal. Ours says about 10 degrees. After checking supplies, the PT should question the patient, verifying the identity, verifying absence of contraindications, and asking the patient about previous cryotherapy experiences and educating the patient on the treatment provided.
Hi Lauren, I'm going to be your therapist today. My name is Brittany. It is Lauren, right?
Uh-huh.
Okay, great. I hear you have a pretty bad wrist sprain.
Yeah.
Okay, well we definitely want to take care of that for you. I just wanted to ask you a few questions real fast. Do you have any sensitivity to cold by any chance? Any incidents of hypertension, high blood pressure, heart disease?
No.
Okay, sounds good. Well, I just wanted to tell you this is the cold pack that I'm going to place on your wrist.
Okay.
And kind of just going to feel like this, so it is pretty cold. But the stages, have you had cold treatments before, cold packs?
Yeah.
Okay, you have. So you'll kind of know the stages you'll go through. The first initial stage that you're going to feel is kind of just cold, and then that'll go into a stinging feeling, and then it'll go into burning and aching, and our last goal will be to feel numbness, so we want it to get all the way numb, and then we can kind of do some exercises then. Okay?
After questioning the patient should be placed in a comfortable position. The body part to be treated should be exposed and draped if necessary. Next, the body part to be treated should be inspected and checked for light touch perception. Circulation should also be checked, and no open wounds or rashes should be exposed. Then, the patient's affected area should be assessed for function, such as range of motion or irritability.
Okay, Lauren, before I apply the cold pack, I'm just going to check a few things. I do want to know, you're going to have it on for about 20 minutes, as I said, until it gets numb. Are you comfortable?
Uh-huh.
Okay, sounds good. The first test I'm going to do, I just want to do some light sensation testing just to make sure you, feel sensitivity. So if you want to close your eyes during this time or turn away, just tell me when you feel it.
Yes. Yes. Yes.
Great. And then I know this is going to kind of hurt, but I'm going to turn it over just a little bit, okay? And I just want to check your pulse here for circulation. All right, good deal. And it looks like it's pretty irritable when I kind of move it around a little bit.
Yeah, a little
okay,
bit.
Sounds good. Well, let's put that ice on it and get it numb, okay?
After positioning the patient, the cold pack should be applied. First, it should be wrapped in a wet towel. Then, the patient should be warned before the pack is applied to the affected area. A timer should be set for about 20 minutes, and the patient should be checked on after the first 2 minutes of treatment, then every 5 minutes preceding.
Okay, Lauren, what I have here is a moist wet towel, and I'm actually just going to wrap the cold pack in that. That'll help it from kind of keeping the cold insulated and then also from sticking to your skin. Okay? Okay, I'm going to apply the ice pack now. If I could just gently have you raise your arm, that way I can kind of put it under you and kind of contour it to your wrist. And I'm just going to place it over here. Okay? Does that feel okay?
Yeah.
Okay, sounds good. Well, I'm going to leave it on there again. We're going to go through those stages, and what I want you to do, if it feels really painful at all, then I'm going to be a couple feet away, and I just want you to kind of raise your hand, and that'll tell me to come over here, and I'll check on you every once in a while. I'm going to set the timer for about 15 to 20 minutes, and we'll go from there.
All right.
Okay, Lauren, it's been about 2 minutes. Are you doing okay?
Mm-hmm.
And does it feel cold, or right now?
Starting to feel pretty cold.
Pretty cold? Okay,
Mm-hmm.
well, we'll just keep waiting. Okay, and now we're at about 5 minutes, so how does it feel now?
I mean,
Are we in that burning stage, or just still cold, stinging?
Yeah, it's kind of at that burning stage.
Okay, well, then it might get to the numbness earlier, so I'll just double check in probably another 3 to 5 minutes, okay?
Okay.
Once the affected area is numb, complete the treatment. When the treatment time is over, remove the cold pack and dry the area with a towel. Remove material used for draping. Assist the patient with dressing if needed. Have the patient perform appropriate therapeutic exercise or apply tape or compression wrap as indicated. Clean the treatment area and equipment according to normal protocol, and assess for light touch sensation to make sure the affected area is numb. Then, assess treatment efficacy. Ask the patient how the treated area feels. Visually inspect the treated area for any adverse reactions. Then, perform functional tests as indicated.
Okay, Lauren, is it numb?
I think so, yeah.
All right, sounds good. Well, I'm just going to gently remove this ice pack. If you just want to lift again, I'm just going to take it away from you. All right, good deal. I'm just going to check again the light sensation testing and make sure that it is numb. So again, close your eyes and tell me if you feel this. No? Okay, then we are good and numb. It's going to be numb for about the next 3 to 5 minutes. So this is when I wanted to do the exercises. That way we can kind of do some motions and you won't feel it. We don't want to take it too far, but that way we can just do some exercises. So what I'm going to do here, I just want to check again. Good, looks good. And that redness will go away. It's just a little red right now from the cold. So if you actually just want to take your arm and take it up, your wrist, and then also down. I'm going to move this, just want to gently lift. Okay. So if you just want to take it up, and then down, up, and down. And we're going to do that about 10 times if you want to keep doing that. Does that feel okay?
Yeah, that feels okay.
Well, it looks like you performed 10 of those. Did that feel okay? Awesome. Now what I want you to have to do, if you kind of need to hold your wrist at all here, you can, don't apply super amount of pressure, but just kind of hold it there. And I want to kind of gently take it side to side.
Okay.
And does that feel okay?
Yeah.
Okay. We're going to do that about 10 times as well.